Jupiter Media presents
So hello and namaste. Welcome to Destination Bangladesh Television. So this program is all about education opportunities in Bangladesh. We are frequently visiting in Bangladesh and telecasting this program through our Destination Bangladesh television show on News 24 television. Television show is like a continuously coming in Thursday 6:30 p.m. and Friday 12:30 noon. So today I'm going to talk about the Gazi Medical College. What stuff like medical options and opportunities are there in Bangladesh. Talking about the quality of education, career outcomes, and Nepalese students and Indian students experience. Professor Dr. M.D. Abdul Mannan is here with us, and he's looking after the principal and professor of pediatrics. Let's welcome him to the show. Dr. Mannan, you are welcome on our show.
Thank you very much. And thank you very much for giving me this opportunity to introduce Gazi Medical College as well as the education system in Bangladesh to Nepal.
Okay.
Thank you very much.
So we are quite happy to having you in this platform so that we can talk about the Gazi Medical College and the services for the international students. We will focus one by one. So let's start our conversation from the Gazi Medical College and its physical infrastructure, sir.
Gazi Medical College is one of the oldest medical colleges in Bangladesh. It's located in the southeastern region of Bangladesh. It's located in Khulna division and heart of the city of Khulna district. And every year we admit 100 students here, both national and international students. 45% seats are reserved for the foreign students. So out of 100 students every year we admit here 45 students from overseas, mostly from India and Nepal. Currently they are studying here.
Okay, so especially talking about the Bangladesh, it's quite popular in South Asia. So for medical education, students are choosing Bangladesh in this case, but there are some problem regarding the food, taste, and the culture and language as well. So what is the language of instruction at your college? Are there support program for students who may not be proficient the medium of the instruction?
Actually, the medium of instruction of medical education in Bangladesh is English. But if we found that some of the students are weak in English, we try to upgrade their knowledge in English. So we arrange some extra classes for them by appointing the English professors or those people who are professional in English. So they get their knowledge from their regarding their conversation, understanding, speaking, everything. So we try to upgrade them. And medical science is a new subject to them. So actually they feel sometimes hard in the terminology. So gradually they will accustom with the words and the terminologies. So, and local language, Bengali, actually it's very, some of the words are mostly similar with Hindi and as well as the Nepali languages. That means Nepalese also knows Hindi very well. So mostly they do not feel any problem in local languages as well. So the students from Bangladesh, those who are their friends, they also help them to know local language as well as the English if someone is deficit there. So this is the way they prepare them and make them update about the English knowledge, conversation, subject, study, and this is the way they move forward actually.
Okay, so especially when we talk about the physical infrastructure in off the record, so let's have a talk about the physical infrastructure and facilities for international students. Could you discuss the infrastructure and facilities that at your college, including modern libraries, laboratories, and hospital affiliations of the clinical training as well?
Gazi Medical College is actually 9-storied building. It's fully academic building. and every floor is dedicated for one subject only. So there is one gallery and tutorial rooms, museums, laboratories, everything in the same floor. The faculty is not to move in another floor to teach the students. And another one side, the faculty is a sitting arrangement. So this is the way 9-storied building is arranged here. And second floor, we have a well-equipped, all the books are available in the library. So library is also with fully internet coverage and air condition is there. And around 200 students can sit there at a time and can do study there. Library opening time is 8 a.m. to 8 p.m. We have a cafeteria in the top floor of this building. So the students, when they need to go there, coffee, they can take coffee there and other foods available there from 8 a.m. to 8 p.m. So students actually enjoy their study here and they do not feel any problem. We have the cadaver in anatomy, particularly we have the cadaver as well as digital education system. And Gazi Medical College is the pioneer in this field. The first private medical college, so far I know, has got this opportunity to teach the students cadaver as well as the digital media system.
Okay. So let's have a talk about the international students community, especially you already elaborate that Nepalese and like Indian students are there and they are enjoying the like environment, campus life, and the good community with the Bengali student as well. Let's have a talk about the like Nepalese and Indian students presence there in Gazi Medical College.
Actually, we have all kinds of facilities here, and there are a lot of committees regarding the student activities like cultural programs, sports program, debate program, then different types of festivals we observe here. So students actually do not feel any problem that they are away from home. We try to create the homely environment here because these people are actually very young, although they entered their first in their life the university education. So this is the system, as well as when the Indian High Commission or Nepalese High Commission is calling them for their own function, usually they join their own function also there. So this is the way they are passing their times here because they are enjoying here their sports, indoor, outdoor games, cultural activities. Mostly they are engaged all these things. And recently we are going to introduce like every week Thursday evening they can practice the singing, dancing because we have a very modern auditorium here as well. It's
Okay.
well equipped and everything is there. So they can practice there. So very soon we will start this thing.
Okay, parents are sending their like children for their higher education and better career as well, but they are moreover worried about their like meal, food, then after their stay at the like hostel. So let's have a talk about the hostel facilities and the like mess facilities for Indian and Nepalese students.
All the overseas students are staying in the hostels. We have two boys hostel and two girls hostels. Mostly the overseas students are staying there. So the boys and girls, those who feel different types of meal they need because we have different types of cook there. They can cook the Indian foods as well as Nepali foods. So the students' requirements we fulfill always, and they always the previous day they inform the cook that this kinds of food better we want to get tomorrow, so they can cook it for them, so they don't feel any problem with their foods as well. And we continuously monitor and supervise their food and meals whether they are getting timely or not. That is very important duty for the professors who are engaged for this because we have a good team who are working with this thing.
Okay. So especially in South Asia, political disturbance is the major issues, and even students and parents are worried about it. So how does the college ensure the safety and security of international students inside campus and hostel?
For the girls and the boys, those who are staying there from overseas, actually we ensure their safety and security, and that's our first and foremost duty of this college. And we try to ensure it because by our own securities are there, as well as the nearest police station we have here. And the police stations, we always inform them, and they send most of the times the civil dress, the DB and special branch polices are moving around both the hostels, including the girls as well as the boys hostels. So it's fully secured all the times. And since 2011, we did not find any kind of miscreant happened with the overseas students here. So they are fully secured here.
Okay, great. So talking about the diversity and inclusion, is there any discrimination among students or different regions from or different communities? So how does the college promote harmony and the inclusiveness among the all students?
Actually, Bangladesh is also a country of different religions, and the people believe in different religions. Those who are celebrating their festivals in different times, and all the peoples, they enjoy the festivals together. This is the habit, the culture of the Bengali people. So here also we arrange all the festivals in the college as well as in the hospitals. We together arrange all these festivals, and the Indian festivals, Bengali festivals, the students, they celebrate together. So we did not find any problem or any discrimination among the students here. And the local students or foreign students, I think a couple of months they take time to be very good friends. So
Okay.
they don't feel that they are actually staying away from their home.
Okay.
So this is the way they are studying here.
Yeah, great. So especially at my journey at like destination Bangladesh television, so featuring plan, we have seen lots of like patient there, patient flow, and different like similar diseases are there in like South Asian belt. So in this case, this is very good opportunity to international students to take exposure in like a clinic. So what sort of the clinical exposure opportunities are there in Bangladesh? Let's have a talk about it.
Gazi Medical College has a 7-storied and 600-bedded hospital, and all the departments are available here. Patients are available here, so students are allowed to handle those patients themselves, and there is no restriction to handle the patients, so they can do practice independently. And before that, when they graduate, they get the medical registration from the Bangladesh Medical and Dental Council, so they don't find any problem in practicing in the hospitals as well. And moreover, the disease pattern in Bangladesh, Nepal, and India almost the same. So when they are getting the graduation degree from here, training from here, they can apply their practical and theoretical knowledge in their own country as well very easily. So they're comfortable in working with this hospital.
Okay, so for medical student, licensing and the certification is the major problem here in like South Asia. So in this case, does the college provide support for, or preparatory classes for the licensing exam like FMGE for Indian students and NMCLE for Nepalese students?
Actually, the education system we run here in such a way for the 5 years program. So the exam they face in their own country for their licensing purposes, most of the exams they face here in the first professional, second professional, third professional, and final professional exam to become a qualified doctor, the question pattern is almost the same. The study is the same. So actually, whatever I have seen, they don't feel any problem to attend those exams. They get the license easily, and they are doing practice in their own country. And we are proud of them. that they first time they pass maximum students, second time mostly finish.
Okay, so nowadays students are trying to study very hardly, but very conducive and enjoyable environment. In this case, what sort of the additional support Gazi Medical College is providing to international students to adjust their academically, socially, and culturally during their stay?
Academically, actually, those students who are a little bit weak, we take care of them special to bring in the line. And our education system, particularly in this medical college, is a little bit different from other colleges. Like we have a very small group teaching system here, and we follow the international rules. Like for the tutorial classes, we take 12 to 15 students in each group. Hospital ward rounds, that means the bedside teaching is 6 to 8 students per group. This is international standard. We try to maintain these teaching facilities here. Number one. Number two is those students who are facing the items. In medical college, item exam frequently, mostly every day they face their item exams, the students. So those students who are coming in Saturday, by Thursday, every item should be cleared. If they fail first time, second time, they will appear. Third time, they will appear. So every Thursday when they go back home at the end of the day, because Friday is the holiday here, so the students finish all their education here for the whole of the week. So there is no headache for the pending study here. Every Saturday when the student comes to the class, they come as a fresh student. So teacher can teach them the new chapter of study, and so that they can receive the study or the lessons easily. So this is the way we run this medical college. And another way, we try to maintain their attendance, like every Thursday 1 hour mandatory they have to sit with their mentor. Every mentor has got 8 to 10 students maximum. So the mentors are always counseling them, those who are sometimes missing the class, those who are lagging behind the exam, those who are missing the exam, those who are not doing well. So mentors are taking care of them. And this is a mandatory class every Thursday. And the progress report must have to send to the student section of the principal's office. So any student is not coming to the Saturday in the lecture class or any other classes like bedside tutorial class, bedside teaching class. So the respective teacher will inform the student's mentor immediately after completing the class. This is your mentee who did not attend today this class. His name is this, his roll number is this. Please take care of this student. So you can see that Saturday is sending this message to the mentor. Thursday he or she must attend the mentoring session. So mentor can rectify him or her, those students. So this is the way actually student doesn't get enough time to drop out from here, from study, from exam, or any other system of education what we try to run over here. And students cannot give any kind of bluff to the professors that I have this problem, that problem. As soon as the mentor is calling them, they come and see the mentor and explain their problem, including their family issue, including their study, including their personal problems. So the mentor is trying to solve all those problems. So it's smoothly running in a systematic way.
Okay, so how can international student get in touch with your admission office or a representative to start the application process and get any additional information they might need?
Actually, admission system in MBBS program in Bangladesh, every year, Ministry of Health and Family Welfare and the Director General of Medical Education's website They publish it, I think, in last week of October or beginning of November. For the foreign students, they open a portal. So those who are qualified in India or Nepal, sitting their own country examination, they are eligible here to apply. So they upload their all documents for their admission, and if the authority thinks that this student is eligible for admission, so they consider their applications and let them know, or even they can see it in the website that they are qualified for admission. So after this, after a certain time, they are getting time to get admission here, and mostly the class starts in June or July. Maybe next year it will be a little bit earlier. What is planning here?
Okay, great. Dr. Manan, you have elaborated very nicely about the Gazi Medical College and study opportunities there in Bangladesh. So we are at the end of this session. So how would you like to welcome more Nepalese students, Indian students, and their parents to visit college so that they can take a decision?
I would like to invite the students as well as the parents of Nepal, those who are interested to send their students here, also from India, please come and visit the college and see the facilities and the faculties. I will arrange the faculty and those people who are interested to send their students to get together and discussion how they want and how what we are providing, so they can get the knowledge practically here. They can see the hospitals, the admission patients here, the number of beds and number of patients admitted. I can also arrange for them to visit the every department with full facilities. It's open for everybody to see. We provide quality education to make the future generation doctor to serve the nation of their own country.
Okay, great. Thank you so much, Dr. Manan, for your valuable time and the thoughts you have shared. Definitely, Nepalese students and Indian students are really interested to know about the Bangladesh medical education system and so on things, and even they are giving response regarding the facilities, quality education, and career outcomes through our television show and online media as well. So once again, thank you so much for your valuable time and thoughts.
For the education system of Bangladesh, and also introducing my own medical college where I have been working here, and the hospital as well. Thank you very much for giving me this opportunity once again.
Okay, thank you so much, sir. Today we have talked with the Professor Dr. Mohammed Abdul Mannan, Principal and the Professor of Pediatrics from Gazi Medical College. We will provide you the similar information through our television show Destination Bangladesh, and even we will like to share you some very successful stories of Nepalese students, the visit response of the parents, and couple of more prominent university and college. Thank you so much for following us in Destination Bangladesh television show through News 24 television, and also follow us on our social media. Till next episode, thank you so much, and stay safe, stay safe, take care, bye bye.